CABS Homecare has a history that's deeply rooted in New York's community. After 40 years, we're still here, still building, and through our circle of care, innovative healing, teaching, and discovery come together.
There was a pocket there where the community wasn't really being served. I've been a founding member of the CABS Corporation, and CABS stands for the Community Action Program of Bedford-Stuyvesant. If you go back in 1968, in that time frame, it was very turbulent times. In the days in the 60s and 70s, you walked the streets, you knocked on people's doors, and you tried to give them information so they could get involved.
Aging in place is more crucial than ever. Our circle is empowered by raising awareness and building resources around issues affecting the elderly and disabled in New York and Nassau County.
From the beginning is that you're providing home care, but there's all these other things that people need. They need access to people who understand the system. They need access to food, for nutrition. They need access to physical therapy. And while they all had doctors and they got the service because they did have a doctor and qualified for Medicaid, a lot of times there was no coordination.
All of the patient services staff, that would mean the home health aides themselves, and we have about 1,200 of them, all of the clients that we have, all of our intake staff, our case coordinators, and of course our beloved nurses.
After working here for 5 years, I recently had an aunt who needed home care. There was no doubt in my mind who I would refer her to. Of course, it would be CABS. Well, with the sense of community that we have built at CABS and also established over the course of the 40 years that we've been in business, that again is leading to the transformational culture that we have been able to create, which has also led to high performance.
I came to United States in 1995. I am the first person in my family that graduated from college here. We actually changed our system, technology system, to help us to be advanced as we need to be, with the reporting, with the payroll, with the billing, everything changed.
It had resonated with our partners, external partners, in some of the initiatives that they have for Brooklynites and also for others outside of Brooklyn.
So when I think of circle of care, I think about our patients. I think about what happens to them when they're out in the community, when they're meeting with their doctors and nurses, when they're at their doctor's appointments, and ultimately what happens when they come to the hospital. They need that circle so that way we are able to interact on all levels. And that's what Kings County, New York City Health and Hospitals specifically, and CABS Home Attendants aims to achieve through our strategic partnership. It's not only what we do in terms of how we work together, but it's how we're servicing population health for our Brooklyn community.
You learn a lot, and you get to meet the staff. You get to meet the people that is in charge of the services, and it's just a wonderful agency to quite a few people, because the service I get is good and I enjoy it, and I know that other people will too.
Follow our journey on social media at CABS Homecare and visit us online at cabshomecare.org.